10 silent signs your body is full of inflammation, and how to fix it fast. Now, inflammation is the #1 cause for pain and discomfort in the body, whether it's in your joints, or if you have headaches, or you have digestive issues, fatigue, brain fog, high blood pressure, clogged arteries, skin problems, cancer, autoimmune conditions like Hashimoto's or rheumatoid arthritis. All these conditions are caused by inflammation, and most people don't even know it. That's why it's called silent inflammation. But what are the actual signs that you have silent inflammation? Now, if you have one of these symptoms, it's not necessarily that you have inflammation. But if you have several of them, chances are that you do. And so here are the 10 signs. No, one is this: you have frequent headaches, especially if you have chronic migraines, cluster headaches, sinus headaches, or any type of headache that comes back on a consistent basis. If your body is inflamed, especially in your head and in your neck, the meninges, which is the covering around your brain and around your spinal cord, can get irritated. You can also have inflammation in the nerves themselves, especially if you have this type of headache that's more on the side of your head, behind your ear. This is a referred pain coming from your neck. So it could be that there's some irritation or inflammation in the nerve itself, which is called a cranial nerve. Or it could be that there's inflammation in your sinuses, especially your frontal and your maxillary sinuses, where they're really swollen and inflamed because of an infection or maybe because of some allergies. And then of course, we have inflammation in the blood vessels, especially the smaller ones that go into the brain, that can cause a type of headache that comes on gradually and usually goes away gradually. Alright, next symptom, stiff neck. If you have a stiff neck, especially if you have to turn your head all the way to the right and to the left, and it just doesn't want to move, or it pops and makes a cracking sound every time, especially when you're doing this type of motion, that's a sign that you have inflammation in your neck. It could be that you slept funny and now your neck is locked up. But if it continues to stay locked up, then it's likely that you need to address some inflammation that's going on in your neck. What could be happening here is that you have a pinched nerve or inflammation in one of the discs in your neck. Or you could have a bulging disc in your neck, or you could just have a subluxation in your neck, where one of the vertebrae in your neck is slightly out of place. All these things can cause that stiff neck, and it's usually accompanied with neck pain, shoulder pain, sometimes down the arm, sometimes into the head, into the eyes, into the shoulder blades. Alright, next one, you have pain or discomfort in your shoulders or your upper back. Now, this is usually caused by stress. Okay, so you have this hump right here. This is called a thoracic hump. What can happen is stress will tense up these muscles right here in your upper back, between your shoulder blades. Sometimes you can actually feel it as a tight muscle. Sometimes you may feel pain in this area that radiates down your arm. There's something called the levator scapular muscle that runs through here. This can get inflamed. You can also have inflammation in the serratus anterior muscle, which is right here underneath the rib cage. This muscle attaches to your scapula right here, and it gets tight and tense with stress. Also, the rhomboid major and minor muscles, which are deeper, they get tense and tight. When they get too tight and too tense, they refer pain into the shoulder blade itself. So if you have pain in your shoulder blade, it could be coming from one of those muscles. Also, you could have inflammation in the ribs themselves. If you had a rib injury, you could have a costochondritis, which is inflammation of the cartilage that connects the rib to the sternum. Alright, the next sign is you have jaw pain, or you have pain when you open your mouth. This could be because you've been grinding your teeth at night, or you could have bitten into something too hard and injured the joint in your jaw. Either way, it can cause inflammation in your temporomandibular joint, or your TMJ. So you can have popping, clicking, pain, tenderness, locking, or limited opening of your mouth. Now, oftentimes, this comes from stress. If someone is constantly stressed out, they tend to grind their teeth at night. The other thing about TMJ is that it's connected to your cervical spine, your neck, and so you can have inflammation in your neck that refers pain into your jaw and into your ears. Next one, leg or foot pain. Now, this could be coming from an old injury, like maybe you fractured your foot, maybe you did something to your ankle, maybe you're on your feet all day long. But it could also come from a condition called plantar fasciitis, which is inflammation of this thick band right here on the bottom of your foot. You usually feel it first thing in the morning or after you get up from sitting for a long time, maybe at work. Or it could be that you re-standing in line somewhere and all of a sudden you feel this sharp pain in your heel. That's plantar fasciitis. Another condition is Achilles tendonitis, which is inflammation of the Achilles tendon right here where it attaches to your heel bone. You can also have inflammation in the ball of your foot, or in the arch of your foot, even in your toes. You can have inflammation in your shin splints, which is along your tibia. You can have stress fractures in your foot or in your lower leg. But all of these can cause leg or foot pain. The next one is you have frequent infections, whether it's getting colds all the time, the flu, strep throat, bladder infections, tonsillitis, bronchitis, pneumonia, boils, or skin infections. These are all signs that your immune system is compromised, and so you're not able to fight off the pathogens, the bacteria, the viruses that are attacking you. Why would this happen? Well, if your body is inflamed, your immune system gets weaker, and it becomes harder for it to fight off these pathogens. Another reason is that if you have a lot of stress, cortisol will suppress your immune system. So you definitely want to avoid processed sugar if you're having any of these conditions, because the more refined sugar you eat, the more your immune system gets suppressed. Refined carbohydrates, refined oils, things like that will also increase insulin, and that can also increase inflammation. Next one, you have acne or other types of skin rashes. Now, acne is usually caused by hormonal imbalance. You can have inflammation in the oil glands of the skin, where you have clogged pores and you have these little red bumps on your skin. You can have rashes from allergies. You can have eczema, psoriasis, all of these different types of skin conditions. What they all have in common is that there is some type of inflammation going on in your body. The next one is constipation. If you're constipated all the time and you have to strain to go to the bathroom, that can put a lot of pressure on your pelvic floor and cause a lot of inflammation in your rectum and your colon. That can also irritate the nerves in that area and cause pain. Another thing is that you can have inflammation in the wall of your colon or your small intestine. There's many different types of colitis that can cause cramping, abdominal pain, diarrhea, bleeding, weight loss, ulcers, diverticulitis, which is inflammation of these little pockets that form in your colon. You can also have stomach pain, bloating, gas, acid reflux, GERD. All of these can be related to having silent inflammation. Now, the next symptom is you have infertility. If you're trying to get pregnant but you can't, this is very frustrating. But what is interesting is that there are studies that show that inflammation in the body can cause both male and female infertility. In women, it can affect the ovaries, the eggs, the fallopian tubes. In men, it can affect the testes and the prostate. A lot of times, this is not found until they do a hysterosalpingogram, which is a dye study. Or they do a laparoscopy to look inside to see if there are adhesions or scar tissue blocking the fallopian tubes. Next one, you have digestive issues. So this can range anywhere from bloating, constipation, diarrhea, stomach pain, nausea, vomiting, heartburn, acid reflux, food allergies. All of these can indicate that you have some type of inflammation going on in your digestive tract, whether it's in the gallbladder, whether it's in the pancreas, whether it's in the liver. Like for example, if you have fatty stool, that means you have inflammation in your gallbladder or your bile duct. If you have pale stool, that means you probably have inflammation in your pancreas. If you have dark-colored stool, that can mean you have inflammation in your liver. So there's many different things that can be causing these digestive issues. Alright, the last symptom is chronic fatigue. If you're exhausted all the time, you're tired, you're dragging, you're sleepy, you don't have the energy to exercise, you don't have the energy to socialize, you don't have the energy to go to work, then you could have chronic fatigue syndrome, and this could be related to inflammation in your body. One big cause of this is that you're sleeping wrong. Okay, you're either not getting enough sleep or you're sleeping on the wrong surface. You need to have a firm mattress. You don't want to be sleeping on a soft surface, because that can throw your spine out of alignment and cause inflammation in your nervous system. So, if you have any of these symptoms, it's highly recommended to get checked for inflammation. The best way to do that is to get a C-reactive protein test. You can also check your ESR, which is the erythrocyte sedimentation rate. These are two good indicators to let you know if you have inflammation or not. So if you're enjoying my content, which I hope you are, and you're applying this knowledge to your health, and you have a success, I would really appreciate you sharing your success story. So click the link down below where you can upload your success story so you can help inspire others.